I'm Timothy Donahue. I am a surgical oncologist. I am the chief of the Division of Surgical Oncology at the David Geffen School of Medicine at UCLA and UCLA Health. I'm a very busy pancreatic cancer surgeon. I usually perform 2 to 3 pancreatic cancer surgeries per week. I have a lot of experience taking care of patients with pancreatic cancer. I would say, for the most part, usually not, except in select cases or select instances. For the most part, pancreatic cancer is thought to be a systemic disease. This tumor cells, for one reason or another, have a high predilection to spreading to other organs. It's amazing to see that, even tumors as small as like 1 to 2 centimeters can spread distantly very early on in what is thought to be their tumor progression. With that in mind, we proceed with extreme caution in recommending that local tumor recurrences be resected, or those patients undergo surgical resection. The studies have shown, and it's thought that about 20 or 30% of pancreatic cancer patients do have exclusively localized disease and die of, or pass away of local tumor without metastases. And so there are, with that in mind, there are some patients who do benefit from what is thought to be an aggressive local or surgical approach. And so the scenario that you're asking about and discussing here is that, a patient who has had surgery, a successful surgery, and then later develops a local recurrence, and whether or not that patient should have a surgical resection. And this is similar to the answers that I've given to the other questions. The answer is yes, if you think that patient does not have any distant disease, or if that patient has one of those tumors where it's the local tumor burden that's going to be the biggest problem for them. And I, as a very busy pancreatic surgeon, have done very few repeat resections for recurrent disease. And it's in patients who have had a long course of treatment to show that, there is no tumor elsewhere in the liver and other organs. And also that it looks like that the repeat resection can be done with not incredible amount of complexity, which is oftentimes the case, or is an issue with local recurrences for pancreatic cancer, because these tumors do grow to encase pretty quickly the major vasculature or blood vessels that are just located very close to the pancreas or close to the resection beds from the initial operation. So all in all, I wouldn't say no to your question. I would say that in very, very select cases, in patients who there's convincing evidence that the local tumor is their main issue, and that there is no systemic disease, and who have undergone a prolonged course of treatment prior to the potential repeat resection. As the basic concepts and principles in this tumor are that the only way that surgery really helps is if one can remove all the disease and have the margins be negative.